Welcome to HealthU. Hello to all our health-conscious friends. Today we're diving deep into a crucial topic that affects everyone's health: the scientific relationship between exercise and the cardiovascular system. If you want to understand how exercise protects your heart and improves your health, this episode is absolutely essential. Did you know? Cardiovascular disease is the leading cause of death worldwide, but a significant portion is actually preventable, and exercise is one of our most powerful weapons. Today, based on the latest scientific evidence published in the authoritative medical journal Circulation Research, we'll reveal the amazing mechanisms by which exercise protects your cardiovascular system. First, let's understand the remarkable changes that exercise brings to the cardiovascular system. When you start exercising, your body responds at two levels: acute responses and chronic adaptations. Acute responses are the immediate changes that occur during exercise. Your heart rate increases, blood pressure temporarily rises, blood vessels dilate, and blood circulation accelerates. These seemingly simple changes are actually perfect demonstrations of your body's sophisticated regulatory systems. More importantly, there are chronic adaptations. When you maintain regular exercise for weeks to months, your heart becomes stronger and more efficient. Myocardial fibers thicken, contractile strength increases, and each heartbeat pumps more blood. It's like giving your heart a complete upgrade. So what is cardiorespiratory fitness? This is the most important indicator for assessing your cardiovascular health. Cardiorespiratory fitness reflects your heart's, lungs, blood vessels, and muscles' ability to work together. Research clearly shows that people with better cardiorespiratory fitness have lower cardiovascular disease risk and longer lifespans. Let's look at how exercise prevents coronary heart disease. Coronary heart disease is the most common and dangerous type of cardiovascular disease. Regular exercise protects your heart through multiple mechanisms. First, exercise improves blood lipids, reduces bad cholesterol, and increases good cholesterol. Second, exercise lowers blood pressure, reducing the heart's workload. Third, exercise enhances insulin sensitivity, preventing diabetes. Fourth, exercise reduces vascular inflammation and maintains blood vessel elasticity. You might ask, can people who already have heart disease still exercise? The answer is, not only can they, but they should. However, it must be done under professional guidance. Research has found that appropriate exercise training for heart failure patients is not only safe, but can significantly improve symptoms, enhance quality of life, and reduce hospitalizations. This brings us to an important concept: exercise prescription. Just like doctors prescribe medication, exercise also requires precise prescriptions. Exercise prescriptions include 4 elements: type, intensity, frequency, and duration. Exercise types are mainly divided into 3 categories: aerobic exercise, resistance training, and flexibility training. Aerobic exercise like brisk walking, swimming, and cycling primarily trains cardiopulmonary function. Resistance training like weightlifting and push-ups mainly strengthens muscle power. Flexibility training like yoga and stretching primarily improves body flexibility. Exercise intensity can be measured using heart rate. Light exercise heart rate is about 50 to 60% of maximum heart rate, moderate exercise is 60 to 70%, and high-intensity exercise is 70 to 85%. The simple formula for calculating maximum heart rate is 220 minus your age. Exercise frequency generally recommends at least 150 minutes of moderate-intensity exercise per week, or 75 minutes of high-intensity exercise. This can be broken down into 5 sessions per week, 30 minutes each of moderate-intensity exercise. For patients with existing cardiovascular disease, cardiac rehabilitation programs provide safe and effective exercise guidance. These professional programs typically include detailed medical assessments, personalized exercise prescriptions, continuous health monitoring, comprehensive health education, and necessary psychological support. How should people of different ages exercise? Children and adolescents should have at least 60 minutes of physical activity daily, including running, games, and sports. Adults should follow the recommendation of 150 minutes of moderate intensity exercise per week. Elderly people, in addition to aerobic exercise, should also strengthen balance and fall prevention training. Many people worry whether it's too late to start exercising at an older age. Research clearly tells us it's never too late to start exercising. Even for people over 80, appropriate exercise can still bring cardiovascular health benefits. There's a dose-response relationship between exercise and health, but this relationship is interesting. It's not that more exercise is always better. There's an optimal range. Light exercise is much better than no exercise at all. Moderate intensity exercise brings the greatest health benefits, while excessive exercise can actually be harmful. This is the scientific basis for what we often call moderate exercise. So how do we translate this scientific knowledge into practical action? First, start simple. If you don't exercise at all normally, you can start with a 10-minute walk daily. Then gradually increase to 20 minutes, then 30 minutes. Second, choose exercises you enjoy. Only exercises you enjoy can be sustained long-term. Dancing, swimming, playing sports, hiking, any activity that gets you moving is good exercise. Third, progress gradually. Don't set overly ambitious goals at the beginning, as it's easy to give up when you can't achieve them. Start with 2 to 3 times per week, slowly increasing to 5 times per week. Fourth, monitor your progress. You can record exercise time, distance, heart rate, and other indicators. Seeing your progress will increase your motivation to persist. Fifth, safety first. If you have chronic diseases or are over 40 and don't usually exercise, it's best to consult a doctor before starting a new exercise program. The future development of sports medicine is very exciting. With the advancement of precision medicine, future exercise prescriptions will be even more personalized. Genetic testing can help us understand individual responses to different exercises. Biomarkers can monitor physical condition in real time. Wearable devices can provide 24-hour health data. Artificial intelligence can analyze this data and provide personalized recommendations. Let me summarize today's key points. Exercise is one of the most effective, safest, and most economical methods for preventing and treating cardiovascular disease. Through multiple mechanisms, including improving cardiorespiratory fitness, lowering blood pressure, improving blood lipids, and enhancing insulin sensitivity, exercise provides comprehensive protection for our cardiovascular system. Remember, exercise is not medicine. It's better medicine than medicine. It has no side effects, only positive benefits. No matter how old you are now, no matter what your health condition is, appropriate exercise can bring you health benefits. Most importantly, exercise is not a burden, but an investment. An investment in your health, your future, and the happy life of you and your family. Thank you for watching today's HealthU Health Education. If this episode was helpful to you, please remember to subscribe to our channel and turn on notifications. We'll continue to bring you the latest and most practical health information. Remember, your health is in your own hands. Let's get moving together.